Hello, Dr. James Bogash, expert in health and longevity, and today we're going to talk about oral health, specifically periodontal health, and how it relates to inflammation. This is not a new association. We have known for a long time that there are links between what happens in the oral cavity and what happens in the rest of the body. Anytime we're looking for hidden inflammation, the first place I always, two things really. I mean, the gut is obviously a player, but beyond that, the vaginal vault and the oral cavity. Those are two places where we can have inflammation going on that people don't necessarily think about, but can have pretty significant impacts on overall health. From the oral cavity, looking at like periodontal disease, where the gums are diseased and infected, poor oral health, have been linked to cardiovascular disease, to dementia, to worsening COVID-19 outcomes, to ICU respirator or ventilator use. It's all over the place, to the point where there is no doubt that the inflammation we have in our mouth is playing a role in our overall health. Now, the thing to understand is that we have a microbiome in the oral cavity. It also connects with our respiratory tract. So the healthier the microbiome is in your mouth, the healthier your respiratory is going to be. So it makes a lot of sense. That's also why people who have like their tonsils out are forever at an increased risk of respiratory disease, because you've just changed the balance of things in the oral cavity. And so in this particular study, looking at 153 people, they looked at periodontal disease, measured the inflamed surface area. They did a marker of chewing efficiency as well. And then they treated the periodontal disease, and they found that when the inflamed surface area went down, two pretty important markers for inflammation, both interleukin-6 and high-sensitivity CRP, went down. So there's a direct, and these were in healthy people. So these aren't people who have cardiovascular disease. These are people where subclinical inflammation is happening. They may not be aware of how much is damaging their long-term health. And until somebody started addressing the oral cavity, they weren't even aware of how they could potentially change their long-term risk factor. So obviously, having periodontal care, whether it's through dentist or periodontist, whether it's home care, is really important. I'm a big fan of like the Sonic type toothbrushes, tongue scraping. I am not a fan of antibiotic or antiseptic mouthwashes. We know that those actually disrupt the bacteria. They are not helpful and can create a problem. I'd rather have us build a healthier microbiome through natural methods rather than through killing off the bacteria, because we all know that anytime we use antibiotics or anything like that, it wreaks havoc on the natural microbiome. And diet plays a huge role. The foods we eat feed good or bad bacteria. Obviously, sugars, especially added sugars, will play a role in that versus plant-based compounds, and just an overall healthier diet is going to help build a healthier microbiome, lower your risk of gum disease, tooth decay, all of that fun stuff. So, good oral health equals good overall health and lowered levels of inflammation. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.